If I were speaking to a new graduate, I think I would encourage them to spend some time with some of our more experienced members who are working with very diverse populations. I would encourage them to go into a practice that serves a large number of Medicaid children, or talk to that pediatric dentist and learn from them what their experience has been. Many of our pediatric dentists provide translators for their families, and the reason for this is that increasingly a higher percentage of children, English is not their first language. So I would really encourage a new graduate to learn about their community, to see what the demographics are in their own state or their own community, and try to gear their practice to meet those needs. If a resident, as they're thinking about starting and building a practice, is curious as to why they should be concerned with the underserved population, I would say it's not only a responsibility, but it's a necessity at this point. There are ways that some of our pediatric dental members have found to make that work in their practice, either by thinking about the ratio of publicly insured to privately insured children, or by looking at how they provide services and providing them in the most efficient way possible so that they can make service to Medicaid children financially feasible. When I look at some of the trends in pediatric dentistry and the percentage of our members who are providing service like assistance completing Medicaid forms, or information about transportation options in the community, or working with social service agencies, they're doing that because it works for their community and they feel an investment in their community, but they're also doing that because they see that their patients need those services in order to obtain that oral health care that's necessary to keep them healthy. I definitely see a role for other helping professions. There's a need to coordinate at some level with those organizations to make sure that children get into care, and to make sure that families understand home care, that they understand the role of nutrition in oral health, that they understand the role of using fluoridated toothpaste or fluoridated water, that they understand the importance of not putting their baby to bed with a bottle. There's a whole number of ways that other professionals, whether that's professionals in education or social workers or nurses, that can reinforce those messages that are really important for families to take ownership of their child's oral health.